Hello everyone, I am Dr. Sandhya. I am a consultant obstetrician and gynecologist practicing at Cloudnine Hospital, Sarjapur Road, Bangalore. Postpartum hemorrhage refers to excessive bleeding following childbirth. Usually a blood loss of more than 500 ml in vaginal deliveries and more than 1000 ml in cesarean sections is considered as postpartum hemorrhage. So postpartum hemorrhage, there are certain cases who are more prone to develop this PPH. Some common causes of postpartum hemorrhage are anemic patients with preeclampsia, whenever the uterus is overdistended, say in twins or big baby as in gestational diabetes mellitus, polyhydramnios or multiple fibroid uterus which complicate pregnancy. In all such cases, the uterus is bigger than the gestational age. So in such cases, when patient enters into labor, they are more prone for postpartum hemorrhage. Also, if the labor process is prolonged and dysfunctional, or if the labor process is too short, which we refer to as precipitate labor, such cases are also more prone for developing postpartum hemorrhage. Even grand multiparous ladies who have delivered more than 5 children, however, it is rare in current day scenario, but still such patients do exist and they are the ones who are more prone for postpartum hemorrhage. What are the measures we usually take to prevent postpartum hemorrhage? Any patient who gets admitted for delivery or labor process can end up in having postpartum hemorrhage without any prior risk factors or medical conditions as such. So all the patients will require prompt monitoring and prompt treatment to prevent this disaster. So once the patient is admitted in the labor ward, we always secure a wide bore IV line, we adequately hydrate the patient, and we closely monitor the progress of labor through a partogram, and if any deviations from the normal progression should always be acted accordingly, and we keep the OT ready, or we keep the anesthetist and neonatologist informed that any time the patient might require any surgery, or we are anticipating postpartum hemorrhage in such cases. So at least after delivery, if at all there is PPH, if there is any immediate surgical intervention which is required, they are also ready with their team. So once this patient is admitted, we'll usually check her blood group, we'll send hemoglobin percentage, and we'll also keep blood ready. Especially in cases of Rh negative pregnancies, blood backup is definitely necessary, because in the last minute, as an emergency basis, if we do require blood, we cannot really run around here and there to cross-match the adequate amount of blood or adequate grouping which is actually required to transfuse to the patient. And we also follow a measure called as active management of third stage of labor. This is in fact the most effective method to reduce postpartum hemorrhage in all the cases who deliver. In active management of third stage of labor, we usually conduct the delivery of the baby, and immediately after that the oxytocics, mainly oxytocin, is administered. We do continuous uterine massage, and we deliver a placenta by a specific method known as controlled cord traction. We can also administer other uterotonic drugs like misoprostol, methyl ergometrine, and tranexamic acid is also administered. These are all the measures which we combinedly take to reduce the amount of blood loss post-delivery. Any patient who has had postpartum hemorrhage needs to be monitored for another 24 to 48 hours, during which phase we check her vitals, we keep a close watch on pulse rate and blood pressure. We also check for uterine contractibility, and we'll check for the amount of the vaginal bleeding that she is having. We should always remember postpartum hemorrhage is a serious life-threatening situation. Early detection and prompt treatment of PPH can certainly reduce the maternal morbidity and mortality. Since postpartum hemorrhage is the most leading cause for maternal mortality across globe, let us all act together and then work more vigilant to reduce this PPH and save mother's life.